Let's do part 2 of what you should be asking for and listening for during an interview. Hi, my name's Lisa. I'm a NICU nurse and a NICU nurse educator. And I want to remind you that during an interview, it is a two-way interview. You're trying to find out if they're a great fit for you, and they're trying to find out if you are a great fit for them. And what you should be listening for is, does the length of the residency program and the intensity of it match the unit I'm going to? If you are going to a level 4 NICU, I would expect your residency program should probably be 16 weeks, maybe 20, maybe 6 months. What's that, 24 weeks? It should be lengthy. The patient population that you are going to see in a level 4 is expansive, and you need time to be able to acclimate to many different things. If you're going to a level 2 or a level 3A, maybe you're seeing 28 weekers and above, I could see that being closer to a 12-week orientation. That's what mine was 21 years ago, was 12 weeks. We did not do any surgeries except for PDA ligations and ROP, mostly micros. No trachs, no G-tubes, nothing like that. 12 weeks felt very safe and comfortable. But if it's a level 4, you need to make sure you're getting a thorough orientation. Ask them how they assign preceptors. Ask them what their classes are going to be like. And then, will you be doing your NRP certification? Will you be taking stable? All of that is great, and you want them to be saying yes. I also think it's appropriate to ask what the support is like after orientation. Our mentors are signed. Is there someone that you will specifically be checking in with? Will the nurse educators be doing check-ins with you? Will you have any sort of follow-up education classes? And then you could also ask, what is continuing education like for the nurses on your unit? I think also kind of watching their reaction to these questions is super important. If they're like, oh, I mean, usually it's 16 weeks, but sometimes we need nurses so fast that we're only doing 12 weeks, I'd be like, oh, that's a red flag. Or if they're like, we have this great supportive program, we're going to assign you a mentor at the end. With the mentor, you have both clinical and personal mentoring. That's amazing. And I'd be like, yeah, I want to work here. So how they react to the questions is going to be very important. If you have any questions about this, please message me, comment below, ask your questions. I'm happy to help in any way. And then check back for part 3, where we are going to talk about the importance of your shadow and what you should be asking the bedside nurses, not the leadership team.